but I'm going to talk about something that might open some eyes, and I hope to get a lot of interest from this lecture. I've been thinking about this subject for a long time. I've been dealing with this subject for a long time, and I think we'll take it from here. We're going to have two screens up here. One's going to be like the words, more or less. The other one's going to be pictures, so I'm going to have to kind of help him advance the slides here for me a little bit. All right, so here we go. Okay, we're going to talk about a subject that has gathered a lot of attention over the last maybe decade or so. It's called EOTRH. It's something... Okay, sorry about that. Inexperience here. Okay, so EOTRH has gathered a lot of attention with the public. The horse owners are starting to hear about it. It's starting to scare people. It's costing people a lot of money. We're getting horses that are being faced with a very serious problem, and there's just a lot of confusion and a lot of, I guess, desperation in our profession right now. So I want to try to open up some eyes and get some ideas going about this, okay? So you can go ahead and start. Yeah, both of them, yeah. Yeah, one's going to be kind of like words, and the other one's going to be more pictures. Okay, so we've heard the abbreviation EOTRH. I think everybody is familiar with the abbreviations and what it means. And Sewell, I remember many years ago, he gave some really good information about EOTRH. He made a beautiful book that I looked at in German and really opened up our eyes about all the different conditions that EOTRH can appear as. And we talked about it a little bit. And so through the years, I've done a lot of research on this myself, and I've had a lot of experience treating horses with EOTRH, and that's what I'm going to go over. Okay, so here's a picture of a horse that has a problem with its foot. If you were a farrier or if you were a veterinarian, what do you think maybe we would be doing for this horse? Anybody have any experience with canker in horses? Have you had any success with it? So, and how did you have success with it? Hygiene. All right. So this condition is very, very devastating. I had a client last year in Florida. I went out and did some gypsy vanners, and the owner of the horses told me he lost 2 horses to canker recently. They took the horses to the University of Florida. They had surgery. They had the best care possible. They could not get rid of the problem. Gypsy vanner horses actually, they have a genetic supertrichosis gene, which means they grow a lot of hair, and so they're at more of an increased risk of developing this condition called canker. All right, so what causes canker? Canker is caused by bacteria. One of the bacteria that causes canker is called treponema. Treponema is a bacteria that causes syphilis in people and animals. It also can be caused with a superinfection with a virus called the bovine papillomavirus. So when you combine these two things, you can get the super exfoliative, like the one in the front there, or the middle, where you get the super hyperkeratinization of the frog and sole. If you have just a treponema infection, it'd be more like a wet, ooey, gunky mess, right? Which ones have you seen, Sol?
I didn't make any probe. I didn't know if it was
Okay, so we'll go ahead and talk a little bit more about EOTRH. Okay, so right now we have a lot of confusion about it. What causes it? Why do we have it? Where's it coming from? I know in Germany you guys started seeing a lot of cases. How many years ago, Sol? That's very helpful information. So, okay, so right now I've been listening to a lot of different people talk about EOTRH, and I've heard people say, well, it's the angle of the incisors. The incisors are getting too long. Okay, I've heard one the other day where I asked, one of my students said, hey, I have a horse with a slant, has EOTRH, and when she asked the veterinarian for help, he said, oh, this is because somebody had used motorized gear on the incisors, and the vibration of the instrument caused the EOTRH to form. And I almost fell out of my chair. I was like, wow, I'm hoping to work with this veterinarian possibly to get the horse treated, and this is what they think is causing EOTRH. It's those damn dental technicians that are floating the front teeth. You get it? And I'm like, really? Okay, so if you were a farrier, would you blame this on the shoeing? The guy had an imbalanced shoeing job, or he trimmed it too close? You get what I'm talking about here? In order to treat this problem, which is very, very severe, you gotta know what you're up against. What it is a bacteria that's living inside the unliving layer of the horse's hoof, in the sole and in the frog. It releases a chemical. The bacteria release a chemical that irritates or stimulates the corium to produce more keratin. It's a bacterial toxin that's stimulating the overgrowth of the hoof, okay? So we have to try to get rid of the bacteria, but it's extremely difficult to do because of recontamination from the environment. This bacteria is coming from the environment, and these horses, even if you trim it off, it comes back, or you don't get rid of it all, and it just grows back. Okay, it's extremely frustrating. Okay, this is kind of like EOTRH. If we're going to treat it, we got to know what we're treating and how we're going to get these antibiotics and mouthwash to be effective. Okay? All right, let's go forward. Okay, there's a picture of the Treponema bacteria there, and there are other theories about EOTRH. Like I read about, it's autoimmune disease, other things that when we go through this, I think we'll explain that these things are not relevant, okay? All right, keep going on the words. Okay, so how has EOTRH been treated? I read articles, I see it on the internet. Everybody says the only way to treat EOTRH is to remove the horse's teeth. Okay, this is not true, all right? We do remove horses' teeth because they have EOTRH, and many times for a good reason, but that is not really the desired treatment. We should be avoiding it and preventing it or controlling it earlier, okay? It's very frustrating when people call you out and, yeah, it's a train wreck and you gotta pull all the teeth, or many teeth. We'd like to avoid that. All right, let's keep going. All right, we'll advance it again. We'll keep going. All right, so I had a really eye-opening experience. I had several people from Japan come to my school. Kazuma's here, he was number one. Then I had a fellow named Kenji came to school, and then a guy named Taki. And Taki and I were talking about Treponema because I was talking to him about EOTRH and how this is involved with the problem. And he says, that's interesting. When I was in Japan, he was working with a study where they treated canker in horses. And you can advance the slide here, the picture one. All right. He got rid of canker with no antibiotics and really without surgery. Now you wonder, how could you do that? Maggots. He used medical maggots. They just trimmed off a little bit. They put a hospital plate over it. They put maggots in there like every 2 or 3 days. Maggots eat dead tissue. They secrete a chemical that kills bacteria. So the maggots actually killed off the treponines, and then they don't eat the living tissue, they only eat the dead tissue. So they just clean it all up. I will advance it again. And there's the same horse shortly later. Do you wish you could do that with EOTRH and have those teeth just miraculously look perfect again? Okay, so this really stimulated my interest because Taki is a super great guy, and I'll give you a lecture tomorrow where I went to Japan because these fellows, they invited me over there, and we had a really good time there. So, but Taki and I talked about this and how, you know, bacteria, treponemes are really a challenging organism. Okay, so let's keep going. All right, so let's go with the words here. Okay, so I want to tell you why I'm here. I'm here to try to help horses. I'm here to try to help riders and trainers, and people like you, all turn out. Okay, when I was a little kid, I didn't grow up with horses, but I happened to live near a racetrack, And one day I jumped a barbed wire fence at the back of the track so I could go in there and make some money working with horses. I didn't grow up with horses, but when I worked at the racetrack, I met veterinarians. I kind of liked what they did, and so what I did was bought books, and I started reading books about lameness in horses, shoeing horses, and I bought what's called the Merck Veterinary Manual. The thing's about 1,200 pages, and is full of all kinds of interesting stuff about bacteria and viruses. Okay, my mom happened to be a microbiologist, and so as I became interested in being a veterinarian, I started learning about diseases. I really got interested in bacteria and viruses, and so, keep going. I decided to become a veterinarian. I read James Herriot's books, so I just wanted to work with horses, live in the country, have a good life, and went to Michigan State, and I worked my ass off trying to get into vet school. I did get in after working there at the University Hospital for Animals. Keep going. I worked at the equine large animal hospital, cleaning stalls and stuff like that. And then I started taking microbiology courses. I took classes using like electron microscopes and stuff like that. So I'm really into bacteria, viruses, and stuff like that. Got into vet school. Keep going. And I had the good fortune of meeting Dr. Gordon Baker. He is the editor of the Equine Dentistry book with Dr. Jack Easley. So he was my teacher, and I used to help him put horses on the table, take the horses off the table when he was doing all these fantastic surgeries and stuff like that. He was a very influential person for me. He was a really great teacher, and he kind of maybe stimulated my interest in dentistry. There was virtually nobody was really interested in dentistry back then, but I had just a little inkling of an idea about dentistry. All right, keep going. All right, so there's Dr. Baker. Let's keep going. Okay, so when I studied microbiology, I found out that there was a guy named Koch, keep going, Robert Koch. He's like the grandfather of microbiology. He invented all kinds of new ideas and theories about bacteria, and he proved that bacteria can cause diseases in animals. What he would do is take some bacteria out of a dead animal, grow it on a growth plate, put it into another animal, and that animal would die of the same disease. This was modern science at that time. This was groundbreaking. The fact that they could prove that viruses, bacteria, and stuff like that could actually create a disease was something new. Okay, so right now we have to rewind the clock because people have not recognized the fact that EOTRH is due to bacteria. Okay, it is. That's the cause of EOTRH. Okay, all of the signs of EOTRH can be explained by the action and the results of the presence of bacteria. Bacterial toxins and chemicals can cause the teeth to undergo what we call like destruction. The lysis, the overgrowth of cementum, all these things that we're seeing in EOTRH are nothing more than the result of the stimulation and action of bacteria. A cavity, bacteria can eat a little hole in a tooth. That's a direct destruction of a tooth. But with EOTRH, what we have is chemicals and toxins that indirectly affect the tooth and the periodontal structures, which lead to all the changes that we see. All right, keep going. All right, keep going. Okay, there's a picture of me working at Michigan State, cleaning the stalls. My job was to disinfect the stalls. We're talking about hygiene, right, Sol? This is what I did. I used to clean the stalls in between the animals being brought in and brought out so we didn't have salmonella, rotavirus, and all this stuff. So I was very involved with that. Okay, when I got out of vet school, yes, there were times where I treated horses with periodontitis. Periodontitis is inflammation, infection, inflammation and destruction of the periodontal tissues, and it's basically due to bacteria. Bacteria is the number one cause for sure. Okay, EOTRH is a symptom of periodontitis. All right, we'll keep going. When we look at these horses, they usually have a real slimy saliva. It's kind of thick and bubbly. It smells bad. You'll see the inflammation of the gingiva and stuff like that. Anyhow, this is a nice picture showing the process of periodontitis. periodontal disease. It is influenced by genetics. I've seen studies where they said in people, 60% of periodontitis is in men and only 40% in women. People have a predisposition to periodontal disease. Horses do too. We see, for instance, that most horses with EOTRH are geldings. Apparently, it's a sex-linked genetic trait to be predisposed to getting EOTRH infection, okay? All right, so there's a combination of bacteria that will affect horses' teeth, and it causes a syndrome. A syndrome is just a whole bunch of different signs and symptoms that are caused by a thing or multiple things. All right, we'll keep going. Okay, so we see horses with the obvious periodontal disease, and our approach could be just, hey, let's just remove all the teeth, and we don't have a problem with that, okay, anymore. We'll just remove the teeth, and you don't have to worry about it. But I think that's not really the approach that we should be promoting. We should be promoting, hey, let's prevent this and control it. And yes, we can. All right, we'll keep going. Let's back up this one right here. Okay, so when we say something is a disease, it means it's something that's causing dis-ease in the animal. Dis-ease means you don't feel good. There's a problem, there's pain, there's destruction, there's something that's causing an issue. Hypercementosis in itself is not a disease. The enlargement of the tooth is just a response to the presence of infectious toxins. It's just responding. The tooth can get bigger, and that in itself is not necessarily going to cause discomfort to the horse or destruction of the tooth. It's changing. Same thing with the lysis of a tooth. It can start to be eaten away by osteoclast and odontoclast. Well, that could be part of a normal physiologic process, but when it goes overboard, like osteoporosis, then it can become a problem, okay? Okay, so when we have a disease, you have exposure. A horse can be exposed to these bacteria and become an asymptomatic carrier. That means, hey, they have no problem, but they're carrying this bacteria or bacterias, because it's not just one, okay? But you can have an infection, that means you're carrying the bacteria, but you can be asymptomatic, or you can have a subclinical infection. That means it's starting, but it's happening so slowly that nobody notices it. And that's where I saw some really great work by Sewell and the other IGF people where they're showing the thickening of the cementum like in 15-year-old horses, right, Sewell? You know, on the outside they look okay, but with a microscope or an x-ray value, you can see the thickening of the cementum. Okay, those are subclinical early cases. Wouldn't it be nice if we could start treating those horses then instead of waiting for all the teeth to be pulled out? Is there any hope for that? Yes, there is. Okay, so I've done it. I've done it many, many times. Okay, if we were to look at a horse that was suffering from tetanus, and we were to look in their body and look for the bacteria that are causing this disease, if we look in their body and their muscles and their nerves, are we going to see any bacteria causing this disease? No, unless we look at the little puncture that is where the organism is living. If we look at a horse with botulism that's not able to get up, are we going to find the botulism organisms in this horse's tissues of its bodies and stuff? No, if it was just organic ingested, if you just ingested some slimy hay or something, the toxin is destroying the animal, killing the animal, but you're not going to see the bacteria. And this is what's been happening with EOTRH. People are looking at microscopic and histologic slides and stuff like that, and they're not seeing the bacteria in the periodontal structures, because that's not where the bacteria are. The bacteria are in the saliva, they're in the gum tissue, they're in the gingival sulcus, you get it? And these bacterial toxins are penetrating into the horse's bones and tissues around the teeth, causing the problem. So this is where people have been missing the boat. These are your scientists, you know, people in the big research places. You know, they're doing their best, they're looking at these structures and stuff, but they're not noticing that there's something else going on that they're missing, okay? And this is what's been happening. All right, let's keep going. Okay, so one of the big things about periodontal disease is that bacteria work together. We're not looking at just one bacteria that's going to cause a periodontal pocket or severe gingivitis and periodontitis. Bacteria work together as a team. These are even different species of bacteria. multiple bacteria will work together to cause pathology and damage. This is one of the advantages that we have when we go to treat this, is that we can actually kind of knock out the legs of a tripod of, say, 3 or 4 bacteria working together. You knock one of the legs off the stool, it's going to fall over. So when we treat EOTRH, we don't have to get rid of all the bacteria or even one specific bacteria, but if we knock out this one and that one, it'll crumble. The attack on the teeth will crumble, and you'll have really good success treating these horses. Okay, so this is just a picture showing, you know, the x-rays and the micrographs of the histology and stuff like that, which I've looked at extensively. And again, if you read the reports, they say, well, we don't see very many bacteria. Well, what they got smart, they started looking at proteins and chemicals that come from bacteria. They're looking at little substrates of bacteria. They're looking at DNA and RNA of organisms and stuff like that, and they're finding traces here and there, but they weren't able to really, you know, put a finger on it and say, oh yeah, these are the bacteria that are doing it. Okay, this is what they've been doing. All right, so bacteria make what are called biofilms. Biofilms are where the bacteria get together. They actually exchange genes for bacterial resistance. If they feel themselves being killed off by an antibiotic, bacteria can actually change their structures and morph to become resistant to antibiotics. Okay, so we'll get into talking about the chlorhexidine. You mentioned earlier about being concerned about chlorhexidine resistance. I'm going to talk about that more in a minute. Okay, all right. But very small amounts of bacteria can have a huge effect. Just a little tiny bit of bacteria in your body can kill you. Okay. And so it doesn't take a lot to cause EOTRH. I will keep going. Okay, there are specific bacteria that work together, and in science they've looked at the red bacteria group. They have a green one, an orange one, and all this stuff. There's all these different types of bacteria that work together, and they're very well known, and one of them is the treponema for sure. There's different types of treponema. Treponema denicola. We have this in our mouth. I'm very concerned when I work with a horse with EOTRH that, you know, I put my hand in their mouth and, you know, get in my mouth. Am I going to get it? Am I going to get this bacteria? Oh, we have these bacteria. Some of them, okay. You got to be a little bit concerned. Okay, so in general, periodontitis is a switch from gram-positive to gram-negative anaerobic bacteria. And so we know what type of bacteria we're up against. We can select antibiotics that usually target these particular organisms. Okay, this picture here is a very interesting horse. You see the roots of the teeth are very exposed. Maybe advance the slide again. Okay, so this horse, when I looked at this horse, I was very stoked. I was like, yeah, this is great. Who thinks all these horses' teeth should be pulled? Looking at this case, you want to advance the slide again, maybe a little more? Ooh. And I was very happy with this. You know why? This was right after I met Hanina, and I took her up here to this Mill Creek Retirement Center, and I had worked on this horse 3 years earlier. It had very inflamed, very smelly, slimy, bubbly saliva, and the teeth looked all just like this. And what I did was I gave the horse antibiotics, and I gave it a mouthwash treatment, and 3 years later, none of the teeth had fallen out, none of them had gotten loose. This horse was fat, happy, running around, grazing. And of course, I saved them how many thousands of dollars by not removing its teeth. That horse lived for about another 12 years. He just recently died about 2 years ago. This picture was taken in 2008. Okay, so this horse was a real eye-opener for me because you know, I had seen periodontitis and I had seen some EOTRH type horses before, but this one was a really interesting one. You can see the hypercementosis. You can see the hypercementosis here, and you can see how the osteoclast and the odontoclast are eating away at the cementum in the teeth. But none of the teeth are loose. No need for extractions. There's no odor. There's no smell. Okay, so treponema, guys, that causes syphilis in people, you can treat it with one simple shot of penicillin. Syphilis in people is a deadly disease that goes into people's brains and can kill you. You know, the guys on the Navy ships, they go into town, have fun. They would literally line up the sailors and stuff and give them a shot of penicillin as they got back on the boat. You guys know what I'm talking about? Yeah. Okay, STIs, right? What are these horses doing when we're not looking at them? Okay, so, but this was really eye-opening. And my point is this, guys, is that you can kill this bacteria. Let's keep going. Yes, it is easy to kill treponema. Treponema is not hard to kill. Okay, here's another picture. You can see that these are the roots of the teeth. And look at the food and stuff in there. This horse does not care. These teeth are dead. I have dead teeth in my mouth. I've got multiple crowns. I have dead teeth in my mouth. They don't cause me any trouble. They don't cause me any pain. And so, you know, again, I'm going to get into it here. There's people that on these internet chats that say, oh, all the teeth have to be removed. These horses are in so much pain. And, you know, really? I can show you case after case after case where these horses are fat and happy because we treated them, and either they had no pain to begin with, but pain goes away too if you treat them. Okay, even the ones that have pain, you can get rid of it with treatment. Okay, so I guess we'll keep going here. Okay, so here's just a nice picture I got off the internet showing a draining tract. You can see the hypercementosis. This is the advanced. There's another one showing the golf balls of cementum. Okay, these are the classic advanced cases. And is EOTRH contagious? That's one of our questions. We know bacteria cause it, but now is it contagious? Yes, it is contagious. That's how it spreads from horse to horse. That's what bacteria do. They spread from one animal to the next. It is contagious, no question about it. Okay. Okay, but do all horses that get exposed to these bacteria develop the disease where they actually have ill effects? No, they don't. Because some animals have good immunity, or they don't get the right combination of bacteria that can work together to cause destruction, okay? The host susceptibility depends on genetics, age, repeated exposure. Yes, repeated exposure is important, okay? Because it's just a slow percolating disease that kind of sneaks up on the horse, sneaks up on the owner, it has a way of getting advanced, okay, because it's not very obvious. Okay, this is another horse who was at Mill Creek, and David and Mark, where are you guys? There you guys are. Okay, so these two guys just covered 130 horses for me over the last few days. And is Roman still alive, guys? Did you guys work on this guy? Okay, so Roman was a very special horse. He literally came into the Mill Creek retirement many years ago with these big golf balls, like in Soul's book. You know, he had the classic big row of golf balls. So what did I do? I gave him antibiotics, I gave him a mouthwash, and one day, probably maybe 8 years later or so, I had to remove this one tooth right here. That's it. We removed the one tooth because it did start to develop a new periodontitis. The tooth actually became loose. The other ones had never been loose before. So I removed that one tooth. Ashley, were you there that day we removed that tooth? I think you were. You were there, right? That was pretty cool, taking that golf ball out. Well, the boys reported that he's just fine. He's still absolutely fat, happy. This horse, guys, is big, beautiful. There's no sign of any pain or discomfort. And again, we're working for a rescue that doesn't want to pay, you know, thousands of dollars to remove all the teeth. But they also want this horse to be an absolute comfort. Those horses at that retirement farm are super well cared for, and they want the best care for their animals. But I like helping out humane societies. I've been running my school with humane societies. I found 4,000 donkeys that are waiting for me in June of this year. Okay, so that's what I'm going to do. So anyhow, the point is that we have hope. We have something to offer owners and trainers, okay, and veterinarians, okay, that are interested in learning, because we don't need to remove all these teeth for a horse to be healthy and happy, okay. This horse, yes, the cementum balls are never going to go away. This is a permanent addition to the size of the tooth. Cementum has been known for decades to respond. The creation of cementum has been known to respond to the presence of bacteria. Okay, advance the slide. Okay. All right, advance this one. Okay, we talked about the exotoxins. Exotoxins are a toxin that comes out of the bacteria, and it can travel through the entire body of the horse. It can affect any organ in the horse, okay? And so just because the bacteria are not necessarily present in the periodontal membrane on an X-ray or on a electron microscope picture or whatever, doesn't mean it's not being affected by that toxin, okay? So this is kind of a very important point, okay, is that toxins can affect tissues where the bacteria are not in direct contact with them. Okay, keep going. Okay, the host response to an infection can actually be detrimental. If the horse starts to get a lot of inflammation, releasing a lot of cytokines, interleukin, tumor necrosis factor, you can go on and on, they can actually cause damage to their own tissue trying to fight off a bacteria. Okay, so we're not, the host is not necessarily going to be able to eliminate the infection unless we help them, okay? So the activation of osteoclasts and odontoclasts is due to bacterial substances, okay? This is well documented that horses' teeth can be dissolved because of bacteria. They can be, cement can be added. These cells are a type of macrophage. A macrophage is a type of white blood cell that comes in to fight infection, okay? These macrophages are altered, and they normally dissolve bone. That's just normal. Bones dissolve, bones create and build. The osteoclasts dissolve, the osteoblasts create. We have the same thing with their teeth. Okay, we have odontoclasts in the teeth which have a job to do, but these bacteria stimulate and turn on these cells to go crazy and overdo their job. Okay, that is what's causing the hypercementosis and the resorption of horses' teeth. Okay, it's not black magic and voodoo, like what's causing this? Yes, we have an answer for this. Okay, let's keep going. There is the autoimmune theory. I just saw a really nice article by a well-intentioned veterinarian describing how mushroom therapy is helping some horses. Yes, it is. But he thought it was because mushrooms are shutting off the autoimmune response in the animal's body through the physiologic process, and that's not true. Mushrooms have antibiotic activity, okay? The mushrooms themselves are like an antibiotic, okay? So that's why they can be very helpful, right? So you guys have been experimenting with the mushroom therapy and having some good luck with it? You too? All right, so we're on to something, aren't we, guys? All right, let's see what else we got here. Okay, so this is a study where this particular bacteria, this is just one bacteria, Porphyromonas gingivalis, was shown to cause cemental hyperactivity. Okay, this is just one bacteria. Okay, let's go for another one here. Okay, here's a study that was from 2006. How long ago was that? 18 years ago. Okay, so I've been looking at this stuff for a long time, guys. And I don't make this stuff up. Okay, this is something that, I'm not just making this crap up. This is real. Okay, go ahead. Yeah, you get I call it the joystick. You try to take the tooth out, and Lily is joysticking around because it's got a big old ball of cementum up there. Right, and classic X-ray sign is cemental nodules on the periodontal surface of the tooth. You see those cemental nodules because that's the result of a stimulation by bacteria. Okay, so here's a study where the bacteria stimulate the cementoplast to make cementum and osteoclast function. Okay, so again, they go into all the little details about the enzymes and the genetics and all that kind of stuff that PhD people like to talk about, okay? I'm just an old country vet, okay, that likes to mess with horses' teeth. That's all I am, okay? But I do like to read this stuff. I seriously do. Anina knows I'm on the internet constantly. I love AI. I mean, I can just, I love this kind of stuff. Okay, so I do read this kind of stuff, and yes, this has been known for a long time. This is not new. This is from 18 years ago, people, okay? I'm kind of surprised, I'll be honest with you, that the researchers and the universities have kind of missed this. I will be a little bit honest about that. Let's go. We'll do some more here. Okay, so our specific bacteria, Okay, treponema is an anaerobic motile bacteria. It's like a little swimmer. It can go through tissues and stuff like that. It does not like oxygen, and thank goodness it is very responsive to antibiotics. It dies very easily. Tannerella is associated with bone loss. When you get these horses that get these big lytic abscesses in their mandibles and around their canines, the bones are just dissolving and they're filling with inspissated pus. You know, you open it up and you take out the cottage cheese that's in there and you start flushing it and all that. It's nasty, okay? And you got a whole bunch of bacteria in there, okay? But they're anaerobic and often gram-negative bacteria. Okay, so we often want to target these with anaerobic antibiotics, like metronidazole is a good one. Your penicillins are good. Cephalosporins are good. Okay, we'll get into this more in a minute. Okay, we do fight bone loss because of these bacteria with Osphos, Tildren, and other ones. Okay, many years ago, I went up to the booth at the AAP convention. I was trying to talk to the guys that sell me the Osphos for navicular and pelositis. I said, hey guys, are you using it for the EOTRH bone lysis? And they looked at me and they're like, well, we can't comment on that because it's not FDA approved yet, but we're doing research on it. Okay, I thought that was kind of interesting that they actually mentioned that somebody was looking at this. Okay, so I started experimenting with Osphos years ago, and the people loved it. The horses really responded to Osphos along with the antibiotics and the mouthwash, because what it is, you're stopping the destruction of the bone. You know how these teeth just start to wiggle around in their jaw because the bone is just dissolving. You do an x-ray and the bone is just like gone. It's just being dissolved, okay? So Osphos, what it does, it slows down the action of osteoclast. It also will be effective for odontoclast because they're both the same type of cell operating on a different structure. One's operating on bone, one's on teeth, but they both basically will respond to these bisphosphonates. Okay. All right, keep going. Okay, treatments I have tried. I've tried a lot of different things, right, Hanina? You know that. I'm always like to experiment with things. I'm a little bit of an experimenter. And the good thing is, I found out that it's pretty easy to do. Okay, and you get good results with this. This is not complicated. This is actually simple, okay? Because if you pick the antibiotics that normally work for these bacteria, you'll have a good result. So what I did, I looked up the sensitivity and resistance of these bacteria. Okay, remember, I was trained as a microbiologist. Okay, so this is what I like to do. Instead of culturing it, like somebody earlier was talking about culturing the sinus, great idea. Before you start to select out your treatment for flushing the sinus, culture it. And even though it's going to take you a few days, hey, it's worth it, because when you get that result back, hey, now you're on to it. Okay, so the problem is with this particular treatment is that you have so many different bacteria that can be involved with these periodontal pockets and down below the gum tissue where maybe you can't even get a sample. Which ones are going to grow? Well, here's the thing. A lot of these things will not grow. Treponema is not going to grow hardly at all in any kind of culturing environment. You have to have special laboratory techniques. It's a good chance your sample's not going to work. You're going to be thrown off the trail. You're going to be culturing bacteria that are not even pathogenic. You're going to be trying to treat the wrong one. So I don't do any of that. It's so simple just to treat them with something that's going to be likely to work. Okay, and that's what I'm going to talk about here. Okay. All right, we'll keep going. Okay, so we talked about it being contagious, and yes, it is. Okay, this is why it's spreading, you can say, like wildfire, Sewell, in Germany. You're getting an explosion of all these EOTRH cases. You're dealing with an infectious syndrome or an infectious problem, okay? All right, we'll keep going. Okay, so what I've tried antibiotics, mouthwash. I did the Osphos. Of course, I pull teeth. If their teeth are really loose and they're really shot, hey, I just pull them out. Okay, but I'm not going along and trying to remove all of the teeth. Okay, I can tell you tons of stories about this, where I've been to farms where they called me out. The horse's teeth look terrible. Some are breaking off. And you got all these things, And I said, well, all we got to do is start the mouthwash and the antibiotic. And they're like, really? I remember this one case. They're like, yeah. And then they told me the horse right next door in the next stall, the vets had come in. They sedated the horse. They said there was blood everywhere. And the teeth were removed. And then when the veterinarians left, the horse started screaming in pain. And these people freaked out. The people in the barn were freaked out. And they're like, they thought I was going to have to do that to this horse. It was an old horse. He was really old, like in his 20s and stuff. I said, no, I'm not touching any teeth. I'm not taking any teeth. I cut a couple of the crowns off. I just cut the crowns off and put them on mouthwash and antibiotics. Oh, they called me back later. Oh, he's doing great, doc. Okay, I can tell you story after story after story like this, where we just keep it simple, stupid, and give them the antibiotics, mouthwash, maybe a phos, and you're on your way. Okay, and I'll show you pictures of this. Okay, if you went to your doctor because you had some rash on your hands, is that dry skin, a little sunburn? What do you got, a little fungus? And, doctor said, just keep an eye on it. All right, keep going. And you came back a little while later, and this is what your hands look like. What would you think about your doctor? The doctor that said, hey, don't worry about it. That kind of looks like EOTRH teeth to me, like, hey, the teeth are missing, they're all swollen and everything. Okay, this is leprosy. This is Mycobacterium leprosy. We were down in Brazil teaching a class down there, right? And we saw this, what was that, little sloth going across the road. I was so happy I got out. I got to pick up a sloth. And I was looking at it, I was all happy. And then I handed it to Hanina, and she's holding it there, and she goes to me, and this is a true story, because she knows who I am. She goes, Dr. Hyde, do sloths carry any contagious diseases? And I said, yes, Mycobacterium leprosy. She freaks out. The thing had a hold of her by her hair. She was screaming and I have pictures of this. I swear to God, it's a true story. And I used that at the presentation. I was doing a group like this, and I showed them a picture of Anita. Oh, she's all happy at first, but when that thing grabbed her and she freaked out. Yeah. Okay, so they do have a problem with leprosy in Brazil and India. Okay, this is a very slow-growing, vicious, nasty bacteria. But, like EOTRH, it is not very contagious. Like one horse that has EOTRH, you think every horse in the barn is going to get it? No. It's like leprosy. I could shake this guy's hand 100 times, and I'm not going to get it. There's only a small chance that I will get leprosy because it is contagious, but there's other factors involved, chronic exposure and other things like that. Okay, so think of this when you think of EOTRH. Would you want your doctor to say, just wait, and we'll just just cut all your fingers off, man. That'll take care of it. Is that, I think I'd be looking for another doctor. Okay, all right, let's keep going here. All right, so there is a good treatment for leprosy, by the way. It is very treatable. Okay, so what we have to be aware of, guys, is that you actually may be part of the problem. I wonder if they're having so much trouble with EOTRH in Germany because all the people are running around floating the horse's teeth now there, putting the speculum on, doing those infundibular carie restorations and little diastema work, right? Are we spreading the bacteria with our hands and with our floats? Of course we are. You can't deny it, okay? We are part of the problem as much as we are trying to be the solution. I have been teaching my students about using mouthwashes for horses, but mostly like in our bucket, using our chlorhexidine, keeping our instruments clean. You guys know we do a talk about disinfection, and I'm big on viruses and bacteria not spreading diseases and all that. I've been doing this since I started my school, okay, because I know that this is super important. And now this is just one more reason to be super more careful. I watched the lecture about the tools today, and I was very impressed how right away, boom, she was talking about disinfecting the tools. Okay, this is super important, guys. Okay, so, okay, when we kill off these bad bacteria, we don't need to kill off the good bacteria. The commensal bacteria are the normal good bacteria and fungi and yeast and stuff that we have in our mouth. They know now that the bacterial microbiome in your mouth is actually very important for the function of your brain, okay? if you have bad bacteria in your mouth, you can often end up with dementia and other problems, okay? This is serious stuff, guys. Okay, so again, when I was at Michigan State, I did a lot of disinfecting of stalls and stuff like that. And you gotta learn how to break the periodontal bacterial infection cycle, okay? We don't need to kill off all the bacteria. In fact, we don't want to do that. We just want to kill off the bad ones. We have to be careful that we don't upset the microbiome of the horse's body, their intestines, their colon and stuff like that too. We don't want to hurt the horse trying to kill off bad bacteria for EOTRH. I just had a lady, she wanted me to pull a horse's tooth for her, and she told me that the vets did the job, but then after they put the horse on antibiotics, it almost died. Okay, and I'm like, whoa, okay, let's give this horse a few weeks here before you bring it over so I can follow up and pull another tooth that they probably should have took the first time. But I'm like, and that horse, I still haven't done it yet because I'm waiting for this horse to stabilize. It was the antibiotics that almost killed her horse, okay, because it got dysbiosis, okay, upset the normal microbiome of the intestinal tract. Okay, so here's a good one. You want to talk about relevant stuff. Okay, I got David and Mark over there at the old folks home working on the horses that my students usually do. We did 54 horses last year in one day, right guys? Is that the record? You weren't there for that, Ashley. We broke the record, man. Okay, so I get a text from the guy that runs the place. He goes, what can you tell me about Tailorella equigenitalis? That's it. And I'm like, why does a guy running a retirement home for horses, they got about 150 head there, want to know about the bacteria that causes contagious equine metritis in horses? So I call him up. I said, why are you worried about a bacteria that we haven't really seen in the United States for the last 20 years? Well, one of my geldings has it, and the feds are here. This is true. He's under federal quarantine because it's a trace back. This horse came from this area at a Disney ranch. They were breeding horses. Somebody imported the horse. They didn't know it, but the horse got through the CEM clearance thing where they clean the penis, you know, and take the samples, make sure it's not present. This is the #1 cause of infertility in breeding horses in America. They have it locked down. We don't want this in America. And he's asked me about it. I'm like, how did a gelding at a retirement home get CEM? He goes, somebody was cleaning the sheaths, and they cleaned the stallion, then they cleaned the other geldings. They didn't use a separate towel for each horse. They took the bacteria from one penis to another, and they actually infected this horse. Yes, he was positive. They came to the farm, they cultured the horse, he's positive. So now what are they doing? They're cleaning the penis with chlorhexidine, and they're coating the penis with antibiotic ointments. It could be chlorhexidine gel or nitrofurazone and other federally approved. There's a federal veterinarian that's showing them how to do it. The regular veterinarian is now taken over. And what I'm telling you this is a serious bacteria. It's a huge economic loss because what it was, the reason they found out this horse was infected, all the mares he bred were not getting in foal and they were miscarrying. And that's why they were like, oh, let's find out what's wrong with this guy. And then a veterinarian cultured him and found CEM. If we had this type of problem causing this much money damage, yeah, we have federal control. They're taking, every horse that comes to the United States is tested for this. If we would have done this on these damn German horses that they were importing, maybe we wouldn't have the EOTRH today, right, Sol? Oh! Oh, it's the immigrants. Okay, so, I'm thinking, man, we got to, pack the penis and the sheath with chlorhexidine and all. I can see that. We can do it. Okay, and that's what they're doing. They actually trained the local vet to do it. You guys missed out on that, didn't you, David? You missed all that. Did you see the vet come in and take the samples and? Okay, but I was like, you know what? If we could have this type of control and investigation on EOTRH, then we would have nipped this thing in the bud. Maybe we would have controlled it. But guess what? The horse is long out of the barn right now, people. This stuff is all over. It's spreading. It is a contagious problem. and we have to really start to think about it. Okay. Okay, let's keep going here. Okay, here's a picture. This guy's name is Mark Powell. He's an Irishman, but he lives up in Pennsylvania, came to my school. I had the pleasure of having him help me teach the students many times. He called me out because up in Pennsylvania they had a fox hunting horse that he noticed had EOTRH. And the local veterinarian, of course, said what? Pull all the teeth. It's going to be like, $8,000. And they said, Doc, can you come up here? And I said, okay, sure. So I went up there. We easily pulled 4 incisors and both of the lower 6s. EOTRH involves the incisors, number 1, canines, number 2, and then usually it starts to go back into the 6s. We removed these teeth. I put them on mouthwash. I gave them Exceed. Exceed is so simple. I give the horse like 18 cc's, and I give them a shot to give 3 to 4 weeks, and then another 3 to 4 weeks, plus the mouthwash, usually twice a day for the first 2 weeks, and once a day for an extended period of time. Okay, all right, we'll keep going. The local veterinarian said I was crazy. I don't know what I'm doing. And why did I only give 1 shot of Exceed? Because it only lasts 4 or 5 days. Doesn't Dr. Hyde know that this medicine is supposed to be repeated on the 4th day, so it goes for 10 days? You think maybe I had thought about that a little bit already, people? Okay, so the guy on the right is the same horse. And then he fox hunted for many years, and he eventually retired, and he lived an absolute gorgeous life. Yes, I would mail them OSFOS through the mail. They were giving him OSFOS. He never lost another tooth. He never had another problem, okay? He didn't lose any more teeth. You can stop this dead in its tracks, okay? It's like syphilis. 1 shot, doc, and hey, you're good to go. You can go back into town anytime you're ready, fella. Okay? Okay, so there are a lot of different antibiotics that can actually be used. If you can find benzathine penicillin, that is 48-hour penicillin. They love to give this to people with syphilis. They give you 1 shot. They can do it just 1 time, and at 48 hours, they give people another shot. Now you're covered for 48 hours. I've been trying to get benzathine penicillin for the last several years, including getting it from Mexico, but it's hard to find. Okay, so Exceed is a more expensive version of it, but it's wonderful, okay? I just had one 2 days ago. I drew up a 60 ml syringe of Exceed for a big warm blood, and I give him 20, and I just hand it to him. I want you in 3 to 4 weeks to give another 20, another 20. Exceed is wonderful because it's affordable. It sure beats, paying $5,000 for pulling all their teeth out. I just did one at home like 3 days ago. They called me out just 3 days ago, and we did it. Okay, so benzathine penicillin is cheaper. Procaine, yes, you can go penicillin twice a day like you normally would, 10 cc's or 30 cc's for 1,000 pounds, twice a day. But, metronidazole can always be combined with other antibiotics. If you think it's really bad and there's reasons for veterinarians to want to use metronidazole, if you have abscesses and you're trying to flush out abscesses, you got inspissated pus, something that's more complicated, then you can go to higher levels of antibiotics even for longer periods of time, okay? I'm not here trying to tell you guys exactly how to do this, okay, because it's complicated to some extent, and there should be veterinarians like this gentleman right here, who I'm very impressed by. You would love to have somebody like Ham here supervising you in what you do with your clients, okay? One of the big problems that we have is most people in this room are not veterinarians. And so technically in most states, in most countries, whatever, you're not supposed to prescribe and diagnose medicines and stuff like that. So it really puts you in kind of a bad position. I just had someone 2 days ago call me. They sent me x-rays. I looked at it. They said the veterinarian said the teeth were normal. This was right here in Florida. I could see at least 10 teeth that probably really should have been extracted. And now, how does the technician tell the veterinarian that he told the owners that the teeth were fine? And I'm like, I said, listen, you're not a veterinarian. It's not your job to run the show. But I tell you what, you can very politely give him my phone number, and I'd be happy to talk to him about the x-rays. And I was going to refer him to a really high-level veterinarian in Florida that could give them further care for the animal, because I am not their veterinarian, okay? So you guys have to realize that this is a sensitive topic, okay? I'm trying to help you guys, because really what you can do is you can tell people that your horse has got symptoms of gingivitis, periodontitis, possible EOTRH, and you need to get a veterinarian to prescribe. Then you're going to have a big problem, because the veterinarian is going to look at you like, what are you talking about? We should just pull all the teeth. Okay, and this is a big problem, guys. All right, so there are other antibiotics that you can use. Here's another case that Hanina worked on with me. I pulled 3 teeth, give the horse the mouthwash, give them the antibiotics. I tell them what to do for the next few treatments. Don't look back. These horses, I usually go back. If I can, I'd like to see them again in 3 months, 6 months, but many of them I come back at 1 year. And I look at it, and I'm just happy as could be. Okay, it's no problem. 1 year later, the horses are fine. Okay, we'll advance the slide again. I'll show you some more cases.
Can you share again what your mouthwash?
Okay, yeah, okay, so I'm going to get into that, but realize that the mouthwash, chlorhexidine is the simplest thing, because most of us carry that in our truck doing the dental work. And so what I do, I usually give them like 8 ounces. I tell them to put that in a gallon jug of water. And then I usually tell them to put 60 cc's over the back of the tongue, so it bathes like most like the 6-7 area kind of, and then come down to the canines, incisors, and their lips and stuff like that. It seems like this bacteria problem resides mostly in the front of their mouth. And so we're really, really effectively treating the front of their mouth with the mouthwash, okay? There are other preparations that you put in the water buckets, you know, in the feed, etc. So there's many different antiseptic or antimicrobial products that are on the market. I'm going to show you some slides in a minute, okay? Okay, here's just a picture where maybe I pulled maybe 4 lower teeth, whatever. And the idea is that, okay, you can pull some teeth, but if you don't put them on the mouthwash and the antibiotics, it's going to continue to be a problem, most likely, and start to affect the other teeth. Okay, so you do need to, even if you only pull 1 tooth, you still need to do this treatment to prevent it from getting worse, okay? Okay, so it can stop the progression, and once you start treating them with the antibiotics and the mouthwash, these horses get better really fast. Horses that are sensitive to touch and for chewing and biting off carrots, a week later, a lot of times they are biting off the carrot. You can put the speculum on, they don't care. You know, you can try to wiggle their teeth, etc. They're not going to care. Okay. Okay, there are some bacteria that are very resistant to antibiotics. This Tannerella, which is the one that causes bone loss. Look at the statistics on this. It's a tough bacteria to kill, okay? And so this is where the mouthwash can be very, very helpful. Because if you combine the mouthwash effect with what other antibiotics you're using, again, you're trying to knock out this bacteria, maybe that bacteria. It's not an exact science, but you're going to hit the target. You're hitting it with like a shotgun, okay? You get a broad action of activity with chlorhexidine. Chlorhexidine is wonderful. It binds to the tissues of the gum tissue and the periodontal structures. It operates well below the gum surface. It can even have effects down towards the roots of the teeth, okay? That's how effective chlorhexidine can be from the surface, okay? It attaches to the tissues, it stays there, and it is really good. Yes, we can have some resistance to chlorhexidine, and so what I recommend is you can try many different types of mouthwashes that are advertised for antibacterial activity. I tell people, hey, go to the dollar store, you know, grab some mint flavored, whatever you think your horse likes, and try it. Watch the gum tissue, make sure that it's not inflamed, the smell goes away. People are usually pretty good about this. You can show them the odor and, you know, the sliminess and stuff. Okay, watch it. If you start to see any problems, hey, take a picture, call me, or switch to a different mouthwash, because there is this resistance thing. It is known in people that do it every day, every day, every day. Eventually, yeah, you're going to start to get some bacteria that are resistant. Okay, but usually I find that you don't need to treat this for a long time. Usually a couple weeks, and I usually have them maybe go for a month with the mouthwash, and then I say, you can stop it. The problem's gone. You've killed it, okay? Now you can watch it and make sure you don't see signs of it coming back. And I'm not sure if I really had one where it really came back, you know.
How do you get out of
Okay, there's not been enough research, but again, if you look at the canker research, like Sewell was mentioning, we know that treponema, denticolid, there's other treponemas that are involved with canker. It's in the manure, it's in the ground and stuff like that, and that's one of the issues. They recontaminate. You know, you can do all this fancy surgery, and then, you know, they're out there walking in it, and they get it again. So in horses, how are they transmitting it? Well, you know, horses do make out with each other a little bit, mostly licking buckets, licking food trays, drinking out of water buckets, grazing the same area. You know, they can transfer bacteria. So you could try to isolate these horses if you want to. You know, that would be something to do. But realize they have found in most horses, 50% of them have treponema. But the number of treponemas go way up in the horses that have EOTRH. You get it? So again, we have these asymptomatic carriers, and it would be really hard to culture and figure out which horses are carrying this. This would be a huge problem, okay? But reasonably, we would not use the same bits in the horse's mouth. We'd clean the bits, et cetera, not share bits. Again, with our instruments, our hands, everything like that, it's all very important, yeah.
Do you see a positive relationships with immunohaemocs and gingivitis with
Yes. Absolutely, no question about it. Yep, I watch my horses, you know, they kind of fight over the hay net, or they stand there and they pull it in different directions, you know. You're absolutely correct. Yeah, that is one way they can do it. Okay, so we mentioned the effect of mushrooms, and mushrooms are very well known to have antibiotic principles. And so way back when people were talking about these products, I was like, yeah, that's cool. But I like to just buy antibiotics. You know what I mean? It's like antibiotics, they're made for this purpose. You know, we can get, I love doxycycline. Okay, we have so many doxycycline deficiency diseases where I live. You know, Lyme disease, anaplasmosis. I can go down the list, all these different diseases that horses get that respond to doxycycline. I love doxycycline because it's very available. Most vets have it on the shelf because they're treating Lyme. They're treating other diseases like anaplasma. It's very affordable. We put it right in the horse's mouth. You know, we can put it on some food or just make it into a paste. Doxycycline is pretty darn effective. I saved her horse's life with doxycycline. Okay, I should tell you this story. I drove 17 and a half hours right before Christmas almost to the Canadian border to get her an Arabian horse that she fell in love with on the internet. 5 days later, back in Virginia, her horse almost died of Potomac horse fever. He got colicky and was about ready to die. And I was like, Hanina, did you take him down by the creek, let him eat grass? Oh, yeah. He likes escargot, eating the snails there. So anyhow, yeah, I gave him tetracycline and saved his life. That's why she's still with me. She puts up with me. Besides that, she had to get a green card somehow. Okay, so mushrooms do help, and there's no question. I don't think they're going to do any harm, but they can be very helpful. Is EOTRH showing up in blood work? I don't know exactly what test you would do on the blood. What are you thinking of? No, it's not that type of thing. No.
Question, I see mention of SMZs at different times in past in this protocols where they would post SMZs for whatever tenor or whatever amount of days, and it seemed that depending on case, within, depending on what he was, a month, 2 months, 3 months, it would come back and you do it again, and it seemed like you just
Yeah.
kind of hold it back with it, didn't it?
Yes. Yeah, because you're not eliminating the entire bacterial population if it's a sinusitis or an extraction site or something. Okay, SMZ is not my favorite for treponema, okay? But I'm putting it on the list because a lot of people have it in the barn. You know what I mean? It's like, what do you got? Okay, you can think about it as a dental technician, you're not necessarily going to get the support of veterinarians, guys. You're going to have a hard time getting people on board to do this. I can tell you that right now. Correct.
If you did that with the metronidazole, is that going to be inadequate?
It it can be very, with metronidazole, you're gonna have a big response, okay, because you're knocking out the legs of these anaerobes, okay, it may not be specifically the right one, but you get one or two of them, and then the other ones crumble. It's like a castle falls, right? So it's a combination effect, but, you know, it does work, but I don't think it works as well in general, okay, because there's always differences. Bacteria can become resistant because of, you know, exposure to antibiotics and stuff like that.
Do you think so? Some of I get pushed or information, I'd say, from some of the veterinary practices that they don't want to use SMZs because they feel like they're not as effective with the buildup of bacterial resistance.
Correct. That's a good concern. That horse I just told you about with dysbiosis that almost died, they overdosed the horse on SMZ. She told me the dosage, and I was like, holy crap, they gave like double. And I was like, of course, I didn't say anything to her, but I was like, whew. And it has to do with the length of time. This is why I like this pulsing of the antibiotics, okay? And I know that treponema will die off very quickly, so why keep them on the antibiotic for a month? You know, we're not dealing with like a chronic deep abscess. This is just a superficial like infection of the gums, you know, and down into the periodontal membrane. In some cases, of course, you do get inspissated pus and stuff like that down inside the jawbone. That's a different situation. Some of those you got to drill open and flush them, you know, and it's a little different. But I do like short-term pulsing of antibiotics because maybe less chance of getting antibiotic resistance, and you got the effect that you want. Why keep going? Lowers the cost, less chance of problems. Okay, let's see what else we got here. Yep.
Okay, we're still on this in the UK, and the early diagnosis for this sort of habit is obviously a few regular graphs, and then the very scientific test is how it's all fight for the parrot.
Yeah.
Okay, and then the heartstrings are called down in the owner, or in your action. You've got to spend empty your bank account and string it in. Now, the handbrake on that sort of treatment is the veterinary profession, yeah, but then to go this way, we're going to need a peer-reviewed paper, yeah, and then to say, oh, okay, this works. Because I can feel a couple of individuals that are going through,
Mhm.
like total fever, you know, and stop on that and get them to listen, say, this can work.
You're free to take this lecture, the PowerPoint, and you can spread it wherever you want to spread it. Okay.
Do you have plans to put this on paper next or what?
This is my plan right here today. This is where I'm coming out. Okay? I'm coming out, people. Okay, I feel like I'm an outsider in many ways, trust me. Okay?
Some of these horses with the resorptive lesions, how do you suspect that a dose of one dose can lead to sequestered treponema?
Okay, so this is the thing. The bacteria are not necessarily inside that resorptive lesion. These are chemicals that are going through the bloodstream and through the tissues, and they are telling these macrophage, odontoclast to dissolve something. They don't have to be right there like a cavity, you know, eating away at the teeth. That's why I think it does work quite well. Okay, now there can be some bacteria inside these very poorly perfused, you know, problems and tissues and stuff, and they could possibly be surviving in there and hibernating in there or whatever. I don't know, but I can tell you what works. You see, I'm basing this on what works, and I'm basing on my analysis of how things work. Okay, but that is a very good question, Steve. So.
I have a lot of questions or remarks, but first of all, I want to ask if you're finished with your lecture because I think we have asked this lecture. So are you finished?
No, I'm not finished. All right, keep going. What time is it? All right, let me see where we're at here. I think we're getting close. I was going to show you a bunch of pictures of some horses. That's going to be fast. I'll just show you a bunch of pictures.
Just keep on going.
All right, keep going. Okay, so there's your mouthwash. There's many different brands on the market. You can make your own. You can go to dollar store. You can buy the stuff on the internet. Okay. Okay, here's a horse that had the early signs of EOTRH, and I treated this horse, and This horse was a real hard horse to work on physically. He was a real tough horse. And this is a happy snap that would go forward. He had mild hypercementosis. You can see there's a little hypercementosis right here. He had a little here and there. But this is a few years after I treated him. And Nina knows this horse. His name's Kai. There was no advancement whatsoever. There's no loose teeth. The horse is happy. The lady's happy. And, of course, when she tells somebody EOTRH, they're like, oh, pull all the teeth. What for? Okay, this is, 3-4 years later. The horse is absolutely fine. There was no change. Once we treated him, it just stopped it in its tracks. Okay, go ahead. Okay, here's a video. Let's see if we can press on that little arrow, make it play. Okay, this was a follow-up check 3 months later. You got cut off. Okay, so this horse I prescribed doxycycline twice a day for 4 days. Nothing mobile. To some extent, yes. You see how they have the big open crown on the 403 tooth? I just left it there. No problems. Okay, so I think Graham Alcock may have sent me these two mares. They live side by side. They were both about 27 years old on the same farm. We don't see this in mares very often, and to see it in two horses that were stablemates, again, this whole idea like leprosy, hey, you stay together with a leper long enough, you're going to get leprosy, maybe. So, yes, it is contagious. These two horses live side by side. One horse, yes, I did pull maybe like 4 lower incisors, but then we treated her with the same treatment. This horse, I didn't remove any teeth, including the one that was, the crown was broken off and, looked like it was hollowed out like a bunch of termites. But both these horses are doing absolutely correct. Okay, so this picture was just sent to me, maybe a couple of weeks ago. I had one recent student that's just getting started. She's probably had 6 EOTRH horses, I would say, in the last 2 months. And I've been working with her. She's very inexperienced. And I'm working with her veterinarians, trying to get them to go along with the antibiotic and mouthwash. And yes, she's doing this now, and she's having really good results. Okay, and she just came to my school like, I don't know, 6 months ago or something. All right, let's keep going. That's just an example case. Here's one of the cases that she sent me right there. This is just a gingival recession. It is a syndrome. You're not necessarily going to see hypercementosis or resorption, but you have periodontitis. It could be the recession of the gum tissue in the bone, the duralamina over the teeth. We don't wait for EOTRH to have these big destructive problems to start treating it. As soon as they have gingivitis, we should be starting this treatment, okay? Gingivitis is not normal in horses. Horses should not have gingivitis. They're very, very healthy animals on a good diet and everything. As soon as you start to see gingivitis, you should be treating it. Okay, here's one that has the receding gum line. You can see there on the number 1s. This horse could very quickly be started on treatment. And again, no reason to remove the teeth. Just because the front of the tooth is exposed, it doesn't mean the tooth is going to fall out. It doesn't mean it's in pain. The back of the tooth is holding it there probably very firmly. If it isn't, well, then you have the option to remove it. Okay. If you do remove some teeth, you are eliminating the microenvironment in which some of these bacteria live, and so you can speed up the healing process if you remove some of the infected teeth. No question about that. And it can be very beneficial for the horse. I'm not against extracting teeth when you think it's going to be helpful or necessary, okay? All right, any more? Okay, here's another one. They often have some missing teeth. A lot of horses, they start off with the true EOTRH symptoms because they've had their teeth broken off. You get crown exposures, pulp exposures, and stuff like that. It's a way for bacteria to get into the pulp, and then they can start this abnormal presence around the teeth and in the teeth. So again, you can see the swollen gums and smelly, slimy saliva. I'll keep going. Here's one with the draining tracts. Okay, this one just came in the last couple weeks. I've been talking to her about treating this one. Again, you can see the signs of hypercementosis. When I see a horse like this, I do not even x-ray it. To me, it's like, what for? I know what's wrong with the horse. I know what to treat it with. I don't need an x-ray to tell me how to treat this horse, okay? You certainly do x-rays, that's fine, that's great. But again, a lot of people would rather not. If they trust you and they know that what you're doing is good for their horse, and I've been doing this for a long time, I have a pretty confidence in myself that I can just treat this horse without doing the x-rays. It's nice to document if you're doing research and studies. That's not what I do. Okay. All right, we'll keep going. Here's another one. Okay, this is a good one because you can see the gingivitis around the canine. Right there, boom. This horse really should be starting to be treated. And you don't need x-rays to know that there's a good chance that this is the early stages of this syndrome. It's a gelding, it's an older horse. You might see some slight hypercementosis and stuff like that. Why not just start them on a shot of Exceed? Why not just give them 4 days of Doxy in the mouthwash? Some horses, we just do the mouthwash. You may just start with the mouthwash and actually get a good enough result. Okay, so I've done that also. I said, hey, why don't you just start treating this gingivitis with the mouthwash, do it for a while, and then we'll stop it if you want to, and let's see if the gingivitis tries to come back or not. You get it? And that way, that's really cheap, okay, because I figured out 8 ounces of chlorhexidine costs like $2, okay? So why not? But I would jump on these cases earlier, and this is where the technicians, guys, you guys are the first line of defense. You're out there looking in these horses' mouth. The people, again, they trust you, okay? They value your opinion, and if you suggest a mouthwash and show them how to do it, it's very quick, it's very simple, okay? And then, of course, you can recheck the horse. All right, so here's one with Hanina where, yeah, this is a fox hunter, and Graham, I think, Graham Alcock may have sent me this one also. So I went over there, and I did remove several teeth on this horse and put him on the mouthwash and antibiotics. And again, he's out in the fox hunting field again. They said, oh yeah, his attitude came right back. He's feeling good. And we did pull several teeth on this horse. You know, they were bad. Okay, we'll keep going. So there's the horse after. These teeth come out pretty easily. You know, they're quite mobile, and they really can it can speed up the healing process. But some of the teeth are just kind of loose, and it's like, should I take it or not? Well, it's a judgment call. Sometimes I try to keep some of the teeth. Maybe it lowers the expense, lowers the problems with maybe a complication of extraction. I had someone recently call me where they tried to remove the tooth while it broke off. Well, I said, yeah, you got the termites. The Odontoclasts are in there eating these teeth, and you try to help the horse by removing the tooth, and it breaks off. Well, it's a little embarrassing, and you're like, maybe I should have just left it there. Okay, so you could always start conservatively with the mouthwash and the antibiotics, being that you're not a veterinarian, you don't have a local anesthesia, x-ray machines, and all this stuff. As a technician, you might suggest that they start treating the horse for gingivitis and stuff like that, and you get it started, and then kind of see where it goes. Okay, you don't always have a veterinarian looking over your shoulder. Not everybody can afford to take it to some big fancy clinic. So I deal a lot with rescues and people that are on a budget. Okay. All right, let's keep going. Okay, here's one with a massive bone loss. These are a whole different ball game. When you get these horses, they have the inspissated pus, between their lower canines and stuff like that. Some of these horses, I put them down. I'll just say, this old horse, he's 29 years old, whatever. we could open this up and flush it, but, you know, maybe this is his day. Okay, we'll make it a good one. And that's it. Okay, but we are dealing with a lot of older horses. They're companion horses. The people love them, but they don't necessarily want to spend $10,000 or whatever and deal with a whole bunch of heavy complications. And so this is a very practical approach, but I'm trying to open your eyes to. Okay, guys? It is very helpful. All right, so what else you got here? Okay, so here's one. Okay, with draining tracts. All right, so Jenny Lindquist is here. Are you here, Jenny? Would you like to stand up, please? Okay, so Jenny is a wonderful veterinarian from Sweden, and I told her about this treatment over the phone through WhatsApp and stuff like that. Jenny, could you tell them a little bit about your experience with this treatment? Went from being very painful, you couldn't really touch his incisors or anything, to a week later, she could now touch the teeth and examine them. Okay, so this is a really good thing for technicians to take home, is that when you run into one of these horses, you don't necessarily want to, because this is like I just asked somebody earlier today, what do? Oh, I level off the teeth, take them out of occlusion. That's not going to help this, guys. You're just pissing the horse off. They're in pain, and you're trying to level off his incisors, taking them out of contact. That is not going to help EOTRH. I'm not afraid, though, to level a slant or get rid of a ventral curvature. If I can sedate the horse and do that while I'm there for some reason, I want to level these incisors with the EOTRH present, I will do it. I'm not even afraid to do that. But if it's a humane thing, well, you can just put them on antibiotics for a while in mouthwash and then come back, a week, 2 months, whatever, and then maybe level off the incisors, make it easier for the owner, for the horse, and yourself, whatever. Because that's not a crisis. Getting rid of the infection is really what's most important. Okay, so Jenny is just an example of some of the people that I've been working with, and she's been very pleased with this. And alrighty. Okay, so what's about the future? Maybe there will be a vaccination to prevent EOTRH, to help control it. Maybe people will get more serious about hygiene and not letting this spread from horse to horse. Maybe internationally they'll start testing those German horses before they go across the border. But yeah, seriously, there needs to be a lot of epidemiology and studies, and then you come up with what are called controlled strategies. But this is going to be really, really difficult. But early detection and treatment is really our answer for at least these horses. We know if we catch it early, we can kind of keep them manageable and keep the horses living a long, healthy life when they get old.
If you came across a younger horse, let's say 6 or 7 years old, that has pretty advanced gingivitis from maybe foxtails, would you just go ahead and
Okay, so yeah, the foxtails, that's a traumatic, damage to the tissues, the gingivitis due to trauma from these little plant-ons. So you're going to pull them out, and yes, chlorhexidine would be excellent for that, but I usually would not put a horse on antibiotics for that. You'll get horses with viral vesicles and viral infections of the mouth. Chlorhexidine is known to kill viruses as well as bacteria, fungi, and all that, so it's really good for even your viral, like horses that get the virus in their mouth, getting the blisters and sores and all that. Chlorhexidine is great. Antibiotics do not kill viruses, and so if you have like a herpes-type virus in the horse's gingiva, it doesn't do any good to give them penicillin or metronidazole. You see, you want to use chlorhexidine or like Abreva. They have this ointment for people with herpes. You can put the Abreva lotion in their mouth, try to help.
I guess I'm more referring to early detection of any form of gingivitis in the incisor area could be early detection that could then lead to bacterial infection of the apex of the root, correct? I mean, any form of gingivitis can introduce bacteria that would cause a problem.
No, I wouldn't say that. No. Okay, so bacteria can get to the apex of the root of a tooth by hematogenous spread. In other words, you get like a cut in your body, bacteria goes into your bloodstream or wherever. You can get bacteria floating around in your body, and they can go to the apex of a tooth and start an infection. Okay, and they can go up the periodontal membrane, kind of like a gravel in a horse's hoof. Bacteria stuff can work their way up with a plant on or something along the gum tissue and get up to the apex of the tooth that way. But just in general, gingivitis on the surface of the mouth does not usually cause apical infections. Okay, that's not normally the way it works.
So what early detection are you looking for then?
Okay, well, I would look at any horse that has signs of gingivitis, of slimy, bubbly, smelly saliva for no reason. It's like, why does this horse have this? That's not normal in horses. Then it does not hurt to use a mouthwash on them. That would be very simple. Just go with the mouthwash first and then keep an eye on it.
What about the red dots that you see? It seems like some of the horses that you were treating, you see the spotting, not necessarily fistulous early on or abscesses, although we would, if it was red, see abscesses.
Yep.
Is that
Those are usually fistulas or draining tracts coming from the periodontal membrane breaking open at the surface, and they can start to bubble before they actually break. A lot of times you push on it, and the pus will come out. As you treat these horses, when you push on it and the pus comes out, they'll be dry. Okay, I'll finish this with one last little story. I can't resist this one. Okay, so many years ago, they decided to regulate equine dentistry in the state of Virginia, and there happened to be a veterinarian that hated technicians, and I'm all for you guys. Okay, that's why I started my school. Okay, and I went out to look at a big, beautiful warm blood horse. I think he was imported from Germany. Big, beautiful warm blood horse, 15 years old, and he had signs of early hypercementosis. He had a couple little draining tracts, but he looked good. He was riding good. Everything was good. And they said, we heard about you treating these horses, and this is a long time ago. This is probably almost 20 years ago. They said, we heard about you treating these EOTRH horses, so we wanted you to look at them. So I looked at the horse. I said, yes, your horse has got early signs, but let's put him on an antibiotic and mouthwash. I told him what to do. I kind of forgot about it. About a year later, he called me up and says, hey, Doc, I'm ready for my yearly checkup. So I go out there and look at the horse. It's beautiful. There's no draining tracts. There's no hypercementosis. The horse is riding beautifully. Everything's great. And then I said, well, this is fantastic. Congratulations. He goes, oh, yeah, by the way, you remember that veterinarian who wanted to remove all the horse's teeth? She said, when she heard that I was the one coming out there to look at the horse, she goes, why don't you hire a veterinarian that has a good reputation? He has a really good reputation as a veterinarian. I'm going to drop the mic.
Thank you very much, Dr. Hyde. It's always great when we have some sort of new... Oh, there's Sue L.